We have covered some questions related to coding guidelines in part 1, and let us begin with the part 2 of the coding. The surgical global package applies to services performed in what setting? Hospital, ambulatory surgery, surgical center, physician's office, and all of the above. And then the correct answer here is answer D, that you can apply that wherever the surgery is performed. What surgical status indicator represent a surgical global package for the endoscopy procedure without an incision? And we have the code, and you must understand what is this status indicator. This status indicator talks about the post-op days, and 000, it is include the endoscopy or minor procedure with related preoperative and post-operative relative value on the day of the procedure. So it has a 0 post-op. Then you have some surgeries which has a 10 days post-op, which we write it with 010, minor procedure with a preoperative relative value, and it has a 10-day post-operative period. So this number indicates the number of the day post-operative days that particular surgery has, and when x-axis is global concept does not apply. So you must know an MMA is a maternity code, usual global period doesn't apply. So this is very important for you. Which statement is true regarding the instruction for the use of the CPT code book? Use an unlisted code when the procedure is modified. Parenthetical instruction define each code listed in the code book. Select the name of the procedure or the service that most closely approximates the procedure or service performed. Select the name of the procedure or the service that accurately identifies the service performed. See, whenever we are doing the CPT code selection, it has to be accurately describing the procedure. So D is the correct answer. Now, which of the following is an example of the case in which diabetes related problem exists and the code for the diabetes is never sequenced first? And we have the option. Now you will find this guideline in ICD-10 under the chapter diabetes, and in that we know that whenever there is a underdosing of the insulin and oral hypoglycemic drug because of the malfunctioning of the equipment, then we write T38.3x6 code first with a 7 character, and then the additional code for the type of the diabetes mellitus and associated complication due to the underdosing should also be assigned, but that will be on the in the second place and the third place respectively, but not in the first place. What statement is true when reporting the pregnancy code? This code can be used on maternal and baby record. No, the chapter 15 codes are used only on the maternal record, and the pregnancy codes are mainly for the pregnant ladies, and they go only on the mother's record. This code have a sequencing priority over the codes from the other chapter, and then we have the other two options also, and the correct option is the second option, that is the option B, where this code have a sequencing priority over the codes from the other chapter, and all these guidelines are very clearly given in the chapter 15, that is the pregnancy coding. This statement is true about Z codes. Now, Z codes are the part of the ICD-10, and we have the guideline under the use of Z code in any healthcare setting. The guideline A, which talks that certain Z codes may only be used as the first listed or the principal diagnosis code, and we can see the list of those Z code. So after reading that, our answer C is the correct answer. You can use them as the primary as well as the secondary code. The standalone CPT codes have a full description. Indented code are listed under related standalone code. An indented code include the portion of the standalone code description which precedes the semicolon. The semicolon is used in the CPT book to save the space. Words following the semicolon can specify which of the following, and then the answer C is the correct answer. It talks about the extent of the service, specific anatomic site, and alternative procedure. So for example, if the code 10080, it talks about the incision and drainage of the pilonidal cyst, simple. So then the indented code talks about the alternative procedure, that is the complicated procedure. Physical status modifier are append to the code listed in which major section of the CPT, and we have the four options, and the correct answer is answer B, because it is there in the anesthesia code and it is the physical status of the patient at the time of the anesthesia. Intra-service time has been measured in studies and is a predictive of the work associated to E&M service. Intra-service times are defined as face-to-face time for office and other outpatient visit, and as unit or floor time for the hospital and other inpatient visit. What is included in the intra-service time for an office and other outpatient visit? And intra-service time is basically the face-to-face time between the doctor and then the patient. So whatever the work the doctor is doing on the patient, that we are calculating here, and that comes under the option A, that is taking of the history, performing the examination, and provides the patient with the counseling. Panel test in the pathology lab section of the CPT book include all the code listed with the panel description. When panel is performed and additional pathology and lab tests are completed, how should those additional tests be reported? So this is a path and lab question, and in the beginning of the path and lab, you will see this guideline. These panel components are not intended to limit the performance of the other tests. If one performs the tests in additional to those specifically indicated for the particular panel, those tests should be reported separately in addition to the panel code. So the last answer, the additional test should be reported separately in addition to the panel code, is the right answer. So the answer D is the correct answer. The following is an example of the correct code combination. The placement of the nasogastric tube is reported with the E&M critical care code. Now this is a very important guideline, because in your E&M under the critical care you have the guideline. There are that in the E&M critical care code there are certain services which are bundled. That is, these services are included in the critical care when performed during the critical care period by the physician, and in that we have the gastric intubation or the nasogastric intubation, and that is included, it is bundled. So we don't code that separately, and that's why this is not correct, and that's why we are zero downing the answer B. The next is total abdominal hysterectomy and an oophorectomy performed within the same surgical session should be reported separately. And we have the option true or false. And definitely the answer is B, that is false, because we have the two code. The first code talk about laparoscopy or a surgical with a total hysterectomy for uterus, and then we have the indented code. This is with the removal of the tube and or ovary. So remember, this is the indented code. How do I know that this? I gave you a hint that the first letter is always in the small case. So I will read this code: laparoscopy or a surgical total hysterectomy for the uterus with the removal of ovary. So I have only one code, so I'll never report that separately. This is a question: when does the anesthesia time begin and end? And this is a very important guideline, because one must know when the anesthesia time start. The time start when the anesthesiologists begin to prepare the patient for the induction of the anesthesia in the operating room or in an equivalent area, and time ends when the anesthesiologist hand over patient to PSCU, that is the post-operative supervision. He doesn't walk away like that. So every word is very important, and pick up the right option, and that is option A. Now true or false. The following code combination 31526 and 69990 are correct if reported together. Now remember, in this case you need to go to both the codes, and if you go to the code 6990, under that there is an instruction, do not report the 69990 in addition to the procedure where use of the operating microscope is inclusive component. So, and under that we have the code 31526. So we cannot write this code along with this code. We will write only one code because it is very clear instruction that is there, and so B is the correct answer. A bronchoscopy is always a surgical procedure, always a diagnostic, sometimes performed unilaterally or bilaterally, always performed bilaterally. Now, whenever you have this question, first thing is pick up the medical terminology, go to the index, find out the code for the bronchoscopy and come there. And many a times above that bronchoscopy, you will have this for endoscopic procedure, code appropriate endoscopy of each anatomical site examined. Surgical bronchoscopy always include the diagnostic bronchoscopy when performed. That means we can do the diagnostic, we can do the surgical, and it is never performed bilaterally. If the problem is only in one bronchus, we can perform unilaterally. If the problems are there in both the bronchus, we can perform bilaterally also. So option C is correct, and you can use your logic, but if you are not, you can always search this the way I told you. So another question on the bronchoscopy: how is an endoscopic diagnostic bronchoscopy coded if it is performed by the same physician during the same session as a surgical bronchoscopy? And we have a guideline which is there, and I told you how to look for it. That go to the index, look for the bronchoscope, pick up that code, come to the particular section, and above that you will see all the guidelines. And this guideline is same for all, that whenever the scopy, a diagnostic scopy is done and then followed by surgical in the same session, we code only the surgical. So answer D is the correct answer. Which place of service code should be reported on the physician's claim for surgical procedure performed in the AAC? AAC stands for the Ambulatory Surgical Center. And at the beginning of your CPT book, you have the place of service code and place of service name. And in our case, it is the Ambulatory Surgical Center, and then the code is 24. So answer C is the correct answer. When you see the symbol hashtag in front of the CPT code, what does it mean? And we have the four options. And in the beginning of the CPT book, you have the certain code symbols which are explained. And in that, under the code symbol heading, you will see that resequence codes that are not placed numerically are identified with the hashtag symbol, and that's why answer A is the correct answer. A 42-year-old patient was undergoing anesthesia in an AC and began having complications prior to the administration of the anesthesia. The surgeon immediately discontinued the planned surgery. If the insurance company requires a reported modifier, what modifier is reported, best describing the extenuating circumstances? Now we know that we have appendix A which explains all this modifier, and we will go through all the numbers, and you will see that the 73 talks about the discontinued outpatient hospital ambulatory surgery center procedure prior to the administration, and that's what happened in our case. So we will zero down the modifier 73. So answer C is the correct. What type of fracture considered a traumatic? And we have the option. So the pathological fracture is basically the bone is broken but there is certain disease that is involved. Malunion is basically the fracture occurs when the broken bone heals abnormally, resulting in a bend, twisting, or the shorten. And if it is a stress fracture, it is mainly because of the small crack in the bone that caused because of the repetitive stress and overuse. But the compound fracture is a kind of an open fracture where the bone is broken and it breaks through the skin. And whenever the trauma trauma happens, if it is of a higher intensity, we will have the compound fracture. And so the answer is D. What is the example of an injury that would be considered a superficial injury? Blister, laceration, nerve injury, and venom insect bite. And the correct answer is blister, because sometimes the laceration can go deeper till the the fat and the muscle, but blister is absolutely superficial. It remains into the epidermis or maybe a superficial part of the dermis, but it is the superficial injury. A pregnant patient present with a baby in a breech presentation. During the delivery, the doctor attempts to turn the baby while it is still in the uterus. The baby turns but then immediately resumes its previous position. Can this service be billed? If so, what is the code? And we have the separate code. No, since the doctor was not unable to successfully turn the baby. No, this procedure is included in the obstetric go bill package. Yes, since the doctor did the work even though the outcome was unsuccessful, report this procedure with the code. Yes, only billing it with postpartum. First of all, it is not a postpartum care, and definitely the first A and B is not the correct answer. The correct answer is answer C, because this is the work done by the doctor, but of course it was outcome was unsuccessful, but yet the doctor should get paid for the work he has done. According to the CPT manual, ophthalmology services are defined by which following term? Whenever you get question like this, your drill should be go to the ophthalmology in the index, find out the codes are 92283. So if you go to this first code and above that the services are written, and according to that you have an intermediate, you have the comprehensive, and you have a special services. So answer A is the correct answer. Anesthesia services includes the following: preoperative, intraoperative, preoperative, intraoperative, postoperative, intraoperative, postoperative, preoperative, postoperative. And here we have the guideline which is very clearly mentioned in your anesthesia guideline, which is there at the beginning of the anesthesia code. These services include the usual preoperative, postoperative visit, the anesthesia care during the procedure, that is the intraoperative. So our answer will be answer B. Okay. Which of the following procedure can be coded separately when performed by the anesthesiologist? And we have all this codes. And again, this is a very important guideline which is covered in your anesthesia section in the beginning, that during the procedure, the administration of the fluid, blood, usual monitoring services, example ECG, temperature, blood pressure, oximetry, capnography, and mass spectrometry are included. Unusual form of monitoring, that is the intraarterial central venous swan gans, are not included. And our question is, which of the following procedure can be coded separately? So the answer will be monitoring the central venous line, because it is given here, central venous line. And that is the last question from this. We will have few more parts, and remember, whenever you are doing this CPT guidelines, your concept will be clear, will get clear more and more.